Welcome to our 6-part training series on respiratory protection. For this first section, we will discuss general infectious disease and workplace safety principles for healthcare workers. These materials were developed to supplement the National Infection Prevention and Control Guidelines prepared by the Ministry of Health of Liberia. We are grateful for feedback and we hope that you enjoy the modules. We would like to thank the individuals and institutions listed on this slide. We will first present an overview of workplace safety and health for healthcare workers, focusing on infectious diseases. We hope that by the end of this module, you will achieve these learning objectives. Some of the slides in this presentation are very detailed, and you are welcome to pause the recording at any time to review the slides in more depth. Occupational health is a branch of public health. We identify hazardous exposures and their health consequences, and determine how to prevent adverse effects. Occupational hazards come in many forms. Safety hazards are those exposures that cause injuries. They include a range of hazards from slips, trips, and falls to explosions or fires that lead to non-fatal or fatal injuries. Health hazards cause diseases. Healthcare workers can be exposed to chemical hazards, such as bleach or other disinfectants. Hazards that are studied with physics include radiation, noise, or heat. The most common hazards are biomechanical hazards, especially lifting. Psychologic hazards may range from witnessing suffering and death to harassment or bullying. Biologic hazards are particularly important for healthcare workers. Infectious diseases present additional concerns, since infected healthcare workers can transmit disease to family, colleagues, and patients. To prevent healthcare workers from becoming infected, we need to understand what the agent or pathogen is, how it is transmitted between people, whether there are ways to improve the healthcare worker's ability to fight off the infection, how the environment affects the agent, and how to control or reduce the hazard. There are many types of organisms that cause infectious diseases. For example, viruses can cause diseases such as measles, Ebola virus disease, or hepatitis B. Bacteria can cause tuberculosis, forms of pneumonia, or other infections. Organisms can cause illness either directly or through the production of toxins. A healthcare worker is anyone who helps care for the sick, including doctors, nurses, aides, helpers, laboratory technicians, janitors, housekeepers, and clerks. Anyone who comes into contact with patients. These are diseases that healthcare workers are familiar with. The agent is the infectious organism. Some of the differences in disease transmission or severity occur because different agents are more invasive, may require a lower infective dose, or survive differently outside the body. Since hepatitis B is a sturdy virus that can survive outside the body, the risk of infection from a blood-to-blood needle stick exposure is 100 times greater than the risk from an exposure to HIV, which is a more fragile virus. However, there's a safe and effective vaccine against hepatitis B that all healthcare workers should receive. Healthcare workers may be exposed in different ways, and some agents have more than one route of entry. Hepatitis B and C, for example, may be transmitted through mucous membrane exposure, as well as through needle stick or sharps exposure. Hepatitis A is transmitted through ingestion of food or water contaminated with fecal material. Immunization is an important approach to protecting healthcare workers from infectious diseases. People can also become immune after having the disease, or through receiving antibodies from others who have once been infected. A variety of health conditions can make individuals more susceptible to some infections. Age is also an important factor of host susceptibility. In Liberia, the Ministry of Health has developed National Infection and Prevention Control Guidelines, which take a comprehensive approach to identifying and reducing hazards for both patients and healthcare workers. The chain of transmission relates how pathogens may be transmitted to susceptible hosts and what reservoirs might be available for pathogens to multiply in. Transmission can take place in different ways for different agents. Some agents have more than one method of transmission. Contact transmission includes direct touching and touching common surfaces. It also includes having droplets from an infected individual that strike the eyes, nose, or mouth of an uninfected individual. This can take place when people are closer than 6 feet or 2 meters apart, and the droplets can be spread by sneezing, coughing, or even just by talking. Contact transmission can also be indirect, through touching common surfaces. Common vehicle transmission can occur through contaminated food or contaminated multi-use medication vials. Airborne transmission is also possible for certain pathogens. If an organism can survive once the droplet dries out, it can float in the air for longer periods of time and can be transmitted through breathing. Both measles and tuberculosis can be airborne. There is still discussion about diseases such as influenza, which are known to be droplet spread but are also shown to be airborne with emerging research. Lastly, other diseases such as malaria and yellow fever can be transmitted through vectors such as mosquitoes. This diagram depicts contact, droplet, and airborne transmission. You can see that in contact transmission, germs are transferred from one infected person to another person through touch. Indirect contact is not shown on this slide, but includes touching common surfaces like doorknobs. In the next panel, droplet transmission, respiratory droplets are generated when an infected person sneezes, coughs, or talks. If the droplets reach the nose, eyes, or mouth of another person, that person can be infected. Droplets are relatively heavy and drop to the ground quickly. They don't travel further than 6 feet, which is why 6-foot distancing is important for protection. Lastly, airborne transmission is a distribution of small airborne particles which can be breathed in by another person. Some agents survive when dried into very small airborne particles and can remain suspended in the air for minutes to hours. These can be breathed in by another person and can travel beyond the 6-foot distance limit for droplet spread. Droplets are large and fall to the ground rapidly unless they strike another surface. However, they also dry out quickly. Smaller particles, called droplet nuclei, can float in the air. If the infectious agent can survive in these tiny particles, they can be transmitted through airborne spread. The important question is whether the dried out particles remain infectious. Some agents do, others don't. Let's focus on the novel coronavirus that is causing the current global pandemic. There are now 7 coronaviruses that affect people. The first 4 are one of the many of the causes for the common cold. They have been in humans for many hundreds of years. However, the newer coronaviruses that have only recently infected humans are much more severe. They cause diseases such as severe acute respiratory syndrome, known as SARS, Middle Eastern respiratory syndrome, known as MERS, and the novel coronavirus SARS-CoV-2. Many other coronaviruses are still zoonotic only, mostly in bats, but also in other mammals and birds as well. The virus itself is named SARS-CoV-2. The disease is called COVID-19. A major problem with this disease, unlike with MERS and SARS, is that infected individuals may shed the virus even when they are asymptomatic or pre-symptomatic. When individuals are symptomatic, there are a variety of presentations. The most common is respiratory disease, which can cause fever, cough, and trouble breathing. The disease has a broad range of severity and is worse in the elderly. Men are also at greater risk. Other risk factors include pre-existing conditions such as heart and lung diseases, diabetes, and immunosuppression. Unfortunately, current data suggests a disproportionate burden of illness and death among racial and ethnic minority groups in some countries. The virus itself can affect many organ systems. Some affected individuals report loss of taste or smell, headaches, or lightheadedness. Some individuals experience abdominal pain, nausea, vomiting, and diarrhea. The virus has been found in the stool of patients with gastrointestinal disease, as well as those with respiratory disease. Some people have developed conjunctivitis after droplet exposure to the eyes. This chart is useful to help distinguish the symptoms of COVID-19 from other common conditions. Various routes of transmission have been documented for COVID-19. To combat droplet and contact transmission, measures can be taken, like social distancing, face shields and masks for healthcare workers in primary care settings, and the use of masks for source control in primary care triage and transport. Frequent cleaning and hand washing can help prevent COVID-19 from being transmitted through common surfaces or through fecal-oral routes. Lastly, when healthcare workers are exposed to ill individuals, the risk increases for airborne COVID-19 transmission. Measures for respiratory protection are important for healthcare workers in isolation units or other high-risk settings. Once we understand the problems hazards cause, we can look for interventions for prevention. A systems approach using the hierarchy of hazard controls is an effective approach. The hierarchy of controls aims to minimize or eliminate exposures to hazards. The hazard controls in the hierarchy are elimination, the most effective, followed by substitution, engineering controls, administrative controls, and personal protective equipment, or PPE. Here is a popular diagram depicting the hierarchy of controls. Again, you can see that elimination of the hazard is the most effective control, while PPE is the least effective. PPE is lowest on the list because it depends on the individual to use it properly each time. It can also be uncomfortable, but PPE is often necessary, especially in healthcare settings where elimination of the hazard may be difficult or impossible to achieve. If possible, reducing host susceptibility is an important way to reduce risk. Both active and passive immunization and use of medications for pre-exposure prophylaxis or post-exposure prophylaxis can be effective. Some of these approaches are used for HIV, tuberculosis, anthrax, and other diseases. Scientists are looking to identify similar protections against COVID-19. Now that we have discussed the various methods of transmission, we can talk about precautions that can be taken. These precautions include engineering controls, such as negative pressure rooms for patients with airborne transmissible diseases, administrative controls, such as providing soap, water, and cleaning protocols for equipment. They also include the use of personal protective equipment. Worker protection is a hallmark of high-performing organizations. Organizations that excel embrace a culture of safety. They recognize their duty to protect both healthcare workers and patients. Part of this includes a strong commitment to leadership and communication with everyone involved in patient care. Everyone has a voice, and every voice is valuable. These recommendations come from a workshop of healthcare leaders, workers, union representatives, and patient representatives meeting to discuss how healthcare worker safety and patient safety are related. One principle is that leaders are critical to implementing person safety for patients, staff, visitors, contractors, and everyone who enters a facility. So it's important to start at the top. Second, frontline caregivers provide important insights about the patient. Data is also critically important to identify problems and to make sure that the solutions are working. Workers need to know how to do their jobs well and how to do them safely. The concept of a just culture is one that does not punish human error, but attempts instead to address the error by examining how it occurred. A multidisciplinary approach enhances quality and safety. Finally, prioritizing the most important problems and working to address them helps programs achieve visible success. Workplace safety requires a coordinated, integrated systems approach. These are the main components. Let's now summarize some of the main ideas we discussed in this module. The primary routes of transmission for infectious diseases are contact, droplet, airborne, vector, and common vehicle. Contact precautions include hand hygiene, gown, and gloves. Droplet precautions have the added requirements of eye protection and a face mask. For airborne precautions, a filtering respirator, such as N95 or elastomeric, must be used instead of a face mask. A systems approach to occupational safety and health uses a hierarchy of controls. Here are some additional resources.